talk to us a little bit about the difference between addiction and eating disorders?
Yes, absolutely. It's one of my favorite things to talk about. There's been a lot of efforts in recent years to try to, disentangle the two because they often cluster and co-occur. I think one of the embarrassing parts of the treatment industry is that we have addiction treatment and eating disorder treatment, and they very rarely are treated concurrently, right? So people oscillate from treatments. They go to an addiction treatment, and they start binge eating or start purging and end up in an eating disorder treatment center. And then they might start using again, and people are bouncing back between the two. And it has to do with the insurance model, right? There's licenses for these different types of care, but we've been really advocating for integrated treatment now for some time. It's much easier said than done. But that being said, there are some people that can clearly lie more on a addiction spectrum, which could be related to family history, genetic vulnerability, exposure to the illicit substances, some of which are no longer illicit. And eating disorders are, characterized by, I'll say this before we go in. A lot of the philosophy in the eating disorder world says, it's not about the food, because there are underlying issues, with restrictive eating. There might be some OCD or some anxiety. There's almost always some trauma. But we know that trauma leads to alterations in the reward pathways that increase someone's susceptibility to addiction-like processes. And that could play out with addiction like eating, right? So one of the challenges in disentangling food addiction from eating disorder is thinking about which one came first, right? So for example, if someone had high levels of early life adversity, they started sneaking food, binging, gained some weight during their teens, and then started purging, let's say at age 20, and then that ran its course for a few years and they ended up in an eating disorder treatment center. If we were to look at that person, would you be able to say that addiction like eating came before the eating disorder behaviors, right? And there are many cases where that's not true, where people did not engage in any kind of food addiction. They just learned how to diet, maybe from a family member, or they learned about it online. And so, dieting is considered a major risk factor for the development of eating disorders, but dieting alone does not cause eating disorders. There has to be some pre-existing vulnerability, right? Whether that be genetic, exposure to trauma. So all things in epidemiology require multiple risk factors, right? And so eating disorders, I think it's important to not lump them into one category. I think it's a disservice when we just say eating disorders to suggest that anorexia nervosa, restrictive type, would be talking about the same thing as binge eating disorder, right? And there's cases of binge eating disorder that are driven by dieting. People started dieting because of weight stigma at the societal level. They internalized a lot of shame around their weight, and they started dieting at a young age, and then they started binge eating. But there's also people that binge eat that never went on a real diet, right? And that's when we have to start thinking about what is the causal structure of some of these disorders of eating, right? So I think we haven't done a good job in the eating disorder field figuring out like the real upstream factors that drive it. I think there is an assumption that dieting is what drives all eating disorder behaviors, but I think an important question to ask is, where does all the dieting come from in the first place, right? Why is it that so many people are driven toward engaging in dieting behaviors, right? Is it possible that the highly processed food environment is contributing to rises in dieting? So yes, when I talk about eating disorders, I try to talk more specifically about anorexia or bulimia or binge eating disorder rather than lumping them all together. They certainly are related. We have transdiagnostic theories of eating disorders, which suggest that people can go from different eating disorders throughout their lifespan. But the eating disorder field has not recognized food addiction or sugar addiction as a real contributing factor in that picture. And that's where a lot of us researchers and clinicians are starting to say, well, hey, wait a minute. Food addiction's been mentioned now in 2,500 peer-reviewed articles. It's been validated. There's a lot of studies showing it in worldwide children, and we need to think about it as a valid construct. Now, where we get into a lot of debate is, like I said, which came first? Because people that have bulimia nervosa have, of all people with food addiction, have the highest rates of food addiction. We're talking about like 75 to 95% of people with bulimia nervosa will meet criteria for food addiction based on the Yale Food Addiction scale. So it lends itself to some questions, right? Like, why is it that people with eating disorders have such higher levels of food addiction? Is it because food addiction is driving the eating disorder? Or is it because the eating disorder symptoms are increasing self-reported food addiction? So for example, if someone is really dieting and they're purging and they're over-exercising, when it's time to fill out the Yale Food Addiction scale, those scores are going to be off the charts, right? So it's important to think about contributors to Yale Food Addiction scores. And what I mean by that is, for some people, it's just about addictive processing, highly palatable foods. And for other people, it really is more of a perception. In other words, they have a lot more subjective food addiction symptoms, right? It asks about, like, when you eat highly processed foods like donuts, cookies, like, do you lose control? Some people are like, yes, all the way, right? But that's subjective, right? Someone might look at that person and be like, okay, you ate one more thing than you wanted to. And for that person, it could feel like a really big deal because they love having control around food, right? So there's a lot of noise in food addiction. And I think that's a point that's important to make, because we want to push the field of food addiction and sugar addiction forward. And so it's important to think about how dieting, how body image, and how weight stigma contribute to food addiction symptoms, so that when we treat food addiction, we're actually treating the food addiction, not treating someone's relentless pursuit of thinness.